Coronaviruses are a large family of viruses that causes respiratory illness, from common colds to severe disease. Examples include MERS and SARS. The new novel coronavirus is a new strain identified in humans, currently causing the epidemic from China and spreading across the world. Coronaviruses spreads through respiratory droplets, either by directly inhaling the infected droplets from somebody who is infected when they cough or sneeze, or by touching surfaces that are infected. And then touching your face without washing your hands. The common symptoms of coronavirus infections include fever, dry cough, or shortness of breath, or difficulty in breathing. Other symptoms may include muscle ache, headache, sore throat, and flu. COVID-19 stands for Coronavirus Disease 2019. It's a new strain of coronavirus disease, also known as novel coronavirus. Novel meaning new, and it was first identified in December 2019. It takes anywhere between 2 days to 14 days to develop symptoms. That's why it's important to make sure that if you have contact from a person who has coronavirus, or if you've come back from a country that is affected by coronavirus, to self-isolate within 2 weeks. Infrared thermometers are used to check for fever. Remember, the incubation period for developing symptoms is anywhere between 2 days and 14 days. It is safe to receive packages from China or handle things from China, as the virus does not live too long outside the human body. As of date, there is no current vaccine against COVID or novel coronavirus. So taking a flu shot does not protect you against COVID or novel coronavirus. Garlic has many health benefits, but up to date there is no evidence that exists that it will protect you from novel coronavirus. Coronavirus can affect all people of all ages, although it has been seen that people with comorbids or pre-existing heart disease or lung disease or reduced immunity have higher chances of getting severe illness. Antibiotics are used against bacteria, and no, it will not protect you against COVID-19 as this is a virus. Majority of the people who have had coronavirus have recovered, and only about 2% of patients have died from the disease, those who were severely ill from it. The best way of protection is to have good hygiene. That includes good cough hygiene or good hand hygiene, which includes cover your mouth and nose when you sneeze, either by your flexed elbow or by using a clean tissue and disposing it immediately after. Hand hygiene includes washing your hands with soap and water regularly or using a hand sanitizer. Avoid touching your face with unwashed hands, or if you've traveled somewhere is affected by COVID-19, self-isolate for 14 days. Keep away from people who have symptoms, respiratory symptoms, who are coughing and sneezing, and avoid unnecessary travel. If you have been exposed to COVID-19 or developed symptoms, call the hospital so they may guide you.
public health advisory from the Aga Khan Health Services, East Africa.